We did a survey of our community last year and asked them what the greatest need was, and by far they all responded more funding.
The main mission of the Neuroendocrine Tumor Research Foundation is to help fund research for a cure in NET cancers. Greene, Director of Research for the NETRF, spoke about the different areas of funding made available and where some of that research has led. She also spoke about the resources available to patients and clinicians regarding NET cancers that the foundation provides. Listen to the full conversation between Greene and CancerNetwork regarding the NETRF and the next steps for NET cancer research. All right, so just to start off, can you explain what the Neuroendocrine Tumor Research Foundation is?
Yeah, so the Neuroendocrine Tumor Research Foundation is a nonprofit that funds neuroendocrine cancer research, and we are the largest global funder of this type of research. And to date, we've funded about $40 million in research funding since our beginning in 2005. We've funded across 76 institutions in 17 countries, so we really do have a global presence. And, in addition to our research mission, we also have a vital mission to really support patients when they're diagnosed with really credible and trustworthy patient support materials. We have, a really great patient guide. We have a fantastic podcast called NetWise, and we just really want to be there when patients do get diagnosed, because unfortunately, this disease, it's very heterogeneous in its presentation. And so about 50% of patients are misdiagnosed initially, and they spend, on average about 4 years trying to get the correct diagnosis across 12 healthcare visits. And so it's a long, arduous process to be diagnosed, and we really want to be there to support patients once they do receive the correct diagnosis.
Going off of that, can you give some background on the research opportunities that are currently underway at the foundation?
Yeah, so we are really excited to fund research in this space. It's an important part of our mission, and so we have one grant cycle per year, which we call our request for applications. And so we generally call for applications at the beginning of the year. So our current process is already underway. But how it works is we call for letters of intent early in the year. We then review those letters of intent for those that seem most promising, and then a subset of those move forward to full applications, which get rigorously reviewed by our scientific review board. And then we award funding toward the end of the year. And this has to be approved by our board of directors. But we really want to select projects that we think are going to make an impact. And so that's our process, and we're currently reviewing letters of intent. So it's already underway, but we do recommend that anyone interested in research funding sign up for our grant newsletter on our website, because that's where we issue announcements, and you can find out when we're issuing our next call for applications through that. In addition to that, we have 4 grant categories. So our one call for applications is in 4 different areas, and those areas are our Accelerator Award, which is our largest award. This is a 4-year, $800,000 award designed for really multidisciplinary collaborative work. We have an Investigator Award, which is a 2-year, $270,000 award. And this is designed for usually individual or a couple of investigators to ask questions about neuroendocrine cancer research. We have a Pilot Award, which is a 1-year, $90,000 award. And this is really designed for pilot studies, feasibility studies, those kind of high risk, high reward ideas that really need some testing before they get additional grant funding. And then we finally have a Mentored Research Award, which is a 2-year, $100,000 award for postdocs and clinical fellows who are really looking to get their start in neuroendocrine cancer research. And so this is an area we're really excited about in terms of building our pipeline of the next generation of neuroendocrine cancer researchers.
We have a lot of really great opportunities for everybody kind of across the cancer care continuum there.
Yeah, we try to think about that, right? Of not trying to meet them where they need funding. Yeah.
So, going off of that previous answer, how can clinicians become more aware of working with the NETRF, as well as informing their patients of the opportunities that the foundation provides?
Yeah, so we work primarily with patients and their families, and we do work with clinicians in certain areas. And so, first of all, our mission is really to help patients understand their illness so that they feel empowered to take an active role in their care. We want to be a valuable resource to them, but also for caregivers and clinicians who are looking for credible information. And so we have on our website a Net Knowledge Center, and anyone can use the Net Knowledge Center. It has a lot of resources on the disease, treatment, as well as you can find our really comprehensive patient guide there, as well as a link to our really great podcast, NetWise. And this podcast features information about the disease, but also it has interviews with clinicians, it has interviews with researchers, and it has interviews with patients. And so it's a really comprehensive podcast that looks at the disease state. Another way we work with clinicians is through our patient education programs. And so we have multiple patient education programs that are in person and some are online. But we work with clinicians to really set the program and to provide that expert information during the patient education program. And so we're really excited about these programs and working with clinicians. And we're always looking for people who are interested in contributing, so they can always reach out if they want to contribute in this way.
Where do you believe the greatest need is for neuroendocrine tumor research?
Yeah, funding. We definitely need more funding. I think most disease states would say that they need more funding, and we believe that's the case as well. We did a survey of our community last year and asked them what the greatest need was, and by far they all responded more funding. And so, when you think about more common cancers or more commonly known cancers like lung cancer or prostate cancer, these cancer types receive hundreds of millions of dollars in funding per year. And we're funding neuroendocrine cancer research at about a $2 million level right now. We hope to increase that, but there's a huge gap there in neuroendocrine cancer funding versus these more commonly known cancers. And so we really try to be strategic with the projects we fund, but it's hard to compete with hundreds of millions of dollars in funding. So we're doing what we can to improve treatments and work toward a cure with our funding level, but definitely need more funding dedicated for neuroendocrine cancer research. And kind of secondary to that is more neuroendocrine cancer researchers, right? We want people who are dedicated to this disease type, who want to, work in this, and they need funding, and so we try to do that through our Mentored Research Award by bringing people into the field. We hope that they will be dedicated and join our cause. And so that's another area where we're working, is really to try to build that pipeline of neuroendocrine cancer researchers. Another thing we're trying to do is provide travel grants to our annual research symposium. So we're really excited that we have dedicated funding for that this year to bring in at least 10 early career investigators to attend our symposium for little or to no cost. And so I think that's another way we're trying to bring people into the field. And so we're excited to have that happen.
I was just looking at your upcoming symposium in the fall for us to cover editorialized, so that should be exciting.
Yeah, that would be great. Yeah, it's a really great symposium. Last year, I think we had about 120 researchers, and it's really focused, and it's really focused on basic and translational research. And so it's just a great symposium, and we see a lot of collaborations form there, which is which is huge. We need people collaborating, especially in these kind of rare cancer types.
Yeah, we're excited to cover that one. So looking ahead to the next 5 years, where do you see neuroendocrine research field kind of headed?
Yeah, so we recently set out to figure this out for ourselves, and so what we did was interview members of the community, of the scientific community. We did a lot of searching in the literature, reading as much as we can about the field, and so what we did is put together a research roadmap. So this is where we as NETRF are headed with our research program, and so this roadmap really defines 3 pillars that represent large gaps in neuroendocrine cancer research. And so we primarily fund basic and translational research at our foundation. And so these pillars are really focused in that area. And the 3 pillars are early detection, improved treatments, and precision medicine. So for each of those, for early detection, we think this is a really important pillar of research. And we have not funded a lot in this space, and we think it's really important because, as I noted, it can take 4 years for patients to receive a diagnosis, which, is time for the cancer to grow and metastasize. And so if we can detect these cancers earlier, we have a much better chance of curing them surgically. And so we feel it's really important to dedicate funding to this pillar to try to detect these cancers earlier. Second to that is improved treatments. And so we're really pleased as a field to have an arsenal of treatments, but these treatments stabilize disease. They don't tend to cause regression of disease or cures for the disease. And so they also have kind of side effect profiles that aren't pleasant for some patients. And so we really need to work toward improved treatments that can, ideally cure, but at least cause some regression of disease. And second to that is really we want therapies that improve quality of life. Some of our patient population can live really long lives with this disease, and while they're doing so, they're taking treatments that can cause unpleasant side effects. And so we definitely want treatments that they can take for a long time that really improve quality of life. And so our 3rd pillar is precision medicine. And so the idea behind this is really to deliver the right treatment to the right patient. And, this is important because, as I mentioned, there are side effect profiles that aren't pleasant for patients. And it affects patients differently. Some tolerate medicines better than others. And so, and also some respond better than others. And so how do we use molecular and genetic information to predict who's going to respond, who's going to, have fewer side effects on a particular treatment. And so we really want to work toward individualizing treatment plans for patients, because ultimately we want to cure this disease, but, in the meantime, we really want, an improvement in quality of life for our patient population.
I know previously you spoke a little bit about research grants, but is there any research that's currently being done by the NETRF that you're excited to see the results of?
Yeah, we're really excited about all of our projects because, like I said, we do pick our work strategically. Because we have 2 million in funding, we want to be very passionate about the work we're funding, and so we're excited to see how it progresses. And like I said, we primarily fund basic and translational research, and we get really excited when we do see that work progress to the clinical research phase. And so I want to give a couple of examples of clinical trials that are now ongoing that resulted from our preclinical work that we funded. And so one of those is a novel CAR T-cell immunotherapy where we funded preclinical work at the University of Pennsylvania for many years. And it's finally made it to clinical trial. And so we're very excited to see how this evolves. So it's a phase 1/2 trial that's sponsored by Chimeric Therapeutics, and they recently reported that the first NET patient was treated with this CAR T-cell immunotherapy, and this patient had really progressive disease, but after the therapy, they now have stable disease at 60 days. And so these results are early, but we're really hopeful given that it stabilized disease. I think that's a really exciting outcome. So we're going to keep watching that trial. Another trial is focused on a target called UPAR. So we funded some preclinical work in the space on this new target, UPAR. So our targeted therapies in neuroendocrine cancer research are primarily targeting a peptide called somatostatin. And so there is a subset of our patient population that they don't express this, or they don't highly express somatostatin. And so they're not eligible to take some of our more targeted treatments. And so this is an unmet need for this patient population. And these are primarily patients who have higher grade disease. And so it's really important that we find a way to treat them in a more targeted manner. And so there are some trials ongoing to look at this target UPAR, which is found on these higher grade neuroendocrine tumors and neuroendocrine carcinomas. And so we're excited to see if it can be a successful target for this patient population that doesn't currently have a targeted treatment. So we're excited about that. And, in general, we're just excited about the work we fund. And so we're waiting to see how it evolves. We do track outcomes on our projects because we think it's really important to tell our donor community where their money is going. And so we provide a lot of updates on our projects to our community. And we're very excited when it moves into the clinical trial phase.
Those sound like great trials. Excited to see the results when they're fully published.
Yeah, me too.
So finally, is there anything else that you wanted to discuss today that we may not have touched upon during our conversation?
Yeah, I think, at NETRF, we're really concerned with some of the proposed and actual budget cuts at the NIH. Our funding model is to fund research in neuroendocrine cancer, but ideally, investigators will gather enough data to go on to receive follow-on funding at the NIH or other funding bodies. And so, it's really important that that pipeline progress so that we can really keep funding this research. It can, form programs of research and so forth. And so we're really concerned about that. But, I think we just want the community to know that we're here. We are excited to continue funding research in this space, and we're trying to increase the amount that we're funding so that we can meet the needs of this community, because it's really important that we keep the pipeline of money, going so that we can move toward better treatments and one day a cure for this disease.